Hi, I'm Dr. Amit Bhandarkar from Spine Center, Chesterfield, and we have with us Dr. Parik. How do you go about diagnosing these conditions?
So typically, I would have people come into my office in two ways. One as a referral from someone like you who is wanting to operate on the bone for any problem, and then you do a DEXA study, which is a study to assess bone density. And when that is low, I would see them to treat prior to a definitive treatment of a bone problem. Or I also see referrals from other providers, who have seen abnormal blood tests, and then they do a bone density and send them to me. Or sometimes I see patients who come in because they have recurrent fractures, with less trauma, with minimum or no trauma, or low trauma fractures, that is. And sometimes I see people who come in because of a fracture that they don't even know how that happened. So a variety of reasons, and that's when and sometimes I see patients for another reason, and I see something on the lab, and then I would order a test, or I routinely order bone density studies in my postmenopausal patient and elderly men. So different types of presentations. But basically, when I see that, I talk to them about the importance of treating this condition.
Perfect. So I think most of these patients are recognized nowadays because of screening mandates beyond certain age. But are there any symptoms that or signs that you think in certain patients that you see questions maybe the patient has osteoporosis? Are there any particular symptoms that are associated with osteoporosis other than the fracture?
So sometimes, people have this bone pain that they cannot explain, and that persists despite normal, treatment for pain. So that I have seen. I also would screen them for osteoporosis when they are on certain high-risk medications like steroids and stuff. Some other medical problems such as malabsorptive disorders, GI or gut disorders, in which people try to eat a normal diet, but those nutrients are not being absorbed and they become deficient in vitamin D and calcium, and then I would screen them. So it's mainly the symptoms may not always be there.
Okay.
I don't always see bone pains and stuff. So if there is no fracture history, let's say, if there are other, when I see a very, very lean person who, because that in itself is a
You hit the point. So I think,
because lately, people are so conscious of how they look, and they, it's good that they exercise and stuff, but they're so, they restrict themselves so much in terms of diet, and they sometimes have low body weight, and if they have a family history, they're genetically predisposed to having, weak bones or, osteoporosis. I would then talk to them about this and test them, meaning order a DEXA study.
Yeah, I think so. The point is well taken. So I think usually there are not much symptoms, and they're screening when we come to know that the patient has osteoporosis, and it slowly creeps in on you. I think nowadays the fad of losing weight, losing even the good weight, which comes from the muscles, and basically patients are protein deficient, and the structure of the bone also is made with protein, and they somehow become osteoporotic. They don't even know that because most of them are asymptomatic and are incidentally noted. I note them in my clinic because I do x-rays on everybody, and I look at their x-rays and I look at how dense the bone looks on the x-rays, and I sometimes want to treat them with some surgeries, and if I'm trying to do a surgery on them, I just try to make sure, and that's when I send it to you saying that, hey, just check out this patient if the patient has osteoporosis or not.